Is it moving? Now I slideshow in my laptop.
Mm, not yet.
Not
We
yet.
haven't had it in a slideshow.
Okay. Just like this, right? It is now, the start screen is my PowerPoint.
Okay.
Okay.
Now we see the background slide.
Okay, thank you. Okay. Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Rizky Ramadhani. I'm a student in Faculty Medicine of University of Islam Malang, and I will present my study. The title is Diabetes mellitus decreased urine potassium levels but not skeletal muscle mass in individuals with age and gender match in Malang region. My study discuss about the compare between two group. First, healthy group and diabetes mellitus type 2 group. And so we can know how diabetes mellitus can affect to muscle mass and urine potassium level. Globally, diabetes mellitus is predicted to increase from 366 million to 552 million in 2030 and became one of the leading cause of death. Type 2 diabetes mellitus is associated with sarcopenia and frailty syndrome due to insulin resistance, which increase pro-inflammatory cytokine and potassium. So, insulin resistance can make degradation of muscle mass faster than the normal condition. And insulin resistance also decrease muscle potassium uptake and decrease urinary potassium levels, as mentioned at Palmer 2040. However, the role of type 2 diabetes mellitus in muscle mass and urinary potassium levels in individuals age and gender match is unknown. And my research aim is to investigate the role of type 2 diabetes mellitus in the skeletal muscle mass and urinary potassium levels among individuals with the similar age and gender in Malang region. So we match the age and the gender for know about affect and diabetes mellitus to group, to both of group. And method of my study, a descriptive analytic study with a cross-sectional design, and respondents are from Batu City, Malang City, and Malang Regency, which is we are calling Malang region. Research was carried out from February to April 2021. The method, first, we find about literature study about potassium electrolyte and muscle mass, type 2 diabetes mellitus patient, preparation for research ethic, and research proposal, and acquiring research ethic. After acquired research ethic, we are searching for respondent. Contact them via phone to ask them informed consent and COVID-19 questionnaire. And after that, we're filling informed consent, physical examination, and finger prick test, preparation of research questionnaire, and medical record. After that, we go to their home, to home visit, to analyze of respondents' inclusion and exclusion criteria. After get a sample or respondent, we are doing a urine collection sample to urinary potassium level measurement using atomic absorption spectroscopy, and beside that we weight measurement to measuring muscle mass with bioelectrical impedance analysis and peripheral blood collection, especially whole blood, to measurement HbA1c level using spectrophotometry. This is tool to BIA. This is a BIA that connected with smartphone to know about muscle mass respondent. So we can check muscle mass respondent and we can analyze it. This is a flowchart of respondent. After getting a respondent from Malang City, we got a 31 and Malang Regency 11 patient, and from Batu City 23 patient. After getting 65 respondents, And we know that 5 patients doesn't meet with our criteria. So we get sample 60 respondent, which is 28 for healthy subject and 32 for diabetes mellitus type 2 subject. The inclusion for healthy subject is inclusion age more than 40 years, and control and age or gender matching do not suffer from diabetes mellitus type 2, which is confirmed in clinical and laboratory and doesn't meet criteria of COVID-19 questionnaire, and the exclusion is undiagnosed diabetes mellitus type 1 and type 2 and suffering another disorder like unstable. And for diabetes mellitus type 2 group, the inclusion is for 1 age more than 40 years and diabetic confirmed 2.5 years and less than 10 years and doesn't meet criteria for COVID-19 questionnaire. And the exclusion for this criteria is undiagnosed type 1 diabetes mellitus and suffering from another disorder like in table. And for your information, guys, two patient in a healthy subject is changed to diabetes mellitus type 2 subject group because there is a higher HbA1c level in respondents, which is 6.5. So we go or making the patient to group diabetes mellitus type 2. This is a result and discussion. There are 5 characteristics in my study. There are age, the average age in healthy subject 59, and the type 2 diabetes mellitus subject is 16. And the statistical result is not significant. And for gender is not significant too. And for HbA1c levels is significant because the p-value is less than 0.05. And the last characteristic is potassium intake questionnaire. This is you can check in the table. Next, for urine potassium level result and discussion. This is we can know that the healthy subject have average and standard deviation 158, and the type 2 diabetes mellitus 31, and lower than the healthy subject, and the p-value is less than 0.05. And we can know that diabetes mellitus can affect the urine potassium level, can make a lower urinary potassium level. For the correlation study between HbA1c and urine potassium levels, correlation coefficient is negative. So when the HbA1c is higher, the urine potassium levels is decreased like that. For muscle mass result and discussion, the healthy subject for average healthy subject is 36, and type 2 diabetes subject is 37, and there is no significances between two groups, and it is show us that diabetes mellitus not affect to muscle mass, but this result is different or contradicted with the several theory and study, as mentioned Perry et al. That show us the study suggesting that diabetes mellitus decreased muscle mass on type 2 DM, like that. And correlation study between HbA1c level and muscle mass, there is no significances. And for muscle mass and urinary potassium levels, there is a significances. Okay, for conclusion in my study, type 2 DM affect urine potassium level, which correlate to hyperglycemic condition, but does not affect skeletal muscle mass value in individuals with matching age and gender in Malang region. Thanks to Rumah Sakit Islam Malang, University of Islam Malang, for technical assistance. And thanks for Ikatan Orang Tua Mahasiswa and Faculty Medicine University of Islam Malang for research funding. And thanks for Merdeka Belajar Kampus Merdeka for publication funding. Okay, thank you for the attention, and I'm welcome to any question. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much for your I'm going to open for the discussion. Is there any questions on the phone? So, regarding the exclusion criteria, I saw that you excluded people with, yeah, can you get like sexual
Yes. Okay.
it's not sexual in my side, but it's okay.
Okay.
So for the exclusion criteria, I saw that the people who are suffering from anemia were excluded. Do you have any reason for this?
Okay, thank you for your question, Miss. Anemia or from anemia is be a exclusion criteria for my study because it can be another metabolism in our body, so can affect the metabolism and affect the result in our study. So the blood or two blood tests or HbA1c level it can be no what is it? Can make a bias in our study.
Thank you.
Yeah.
Thank you. Very interesting.
Okay.
Another one. Is there any questions from the audience? Another one is about the urine potassium level. So is this also common in all diabetes or only diabetes type 2? Or the difference in urine potassium level?
Can you repeat your question because I can hear you?
Alright. So the difference in urine potassium levels, are they found as well in all type of diabetes or only found in diabetes type 2?
Okay, thank you for your question. Okay, principally, the differences or any condition, another condition, and the of the urinary potassium levels, it can be affect for the other condition like intake or the metabolism and the hormone and the glomerular filtration rate. And in this study we are know about can know that urinary potassium level can change in diabetes mellitus because there is a glomerular filtration rate that is confirmed and approved with my friend's study, Larianti 2021. So there is more reason that can change the urine potassium level beside diabetes mellitus. It's intake kalium and muscle mass and the metabolism in body, like that, Miss.
Thank you, Vicky.
Yes.
Very interesting.
Thank you.
Thank you very much for sharing your research with us.
Yes, with
So I'd like
pleasure.
to